Imagine waking up to a morning that feels just like any other. Perhaps you step onto the porch, coffee in hand, feeling the gentle warmth of the sun, the familiar rhythm of your neighborhood coming to life. Yet beneath these quiet rituals, hidden changes may be unfolding inside the body, silent but powerful, shaping the course of your golden years. For millions of seniors in the United States, diabetes has become a familiar companion, sometimes managed, sometimes feared, always present. But what many don't realize is that diabetes is not just about blood sugar and diet. It is a complex condition, interwoven with the health of your heart, your brain, and especially your risk for stroke. Today, let's pull back the curtain on this hidden connection, because understanding it could change and even save your life. Let's start with a story. Meet Helen. At 67, Helen had lived with type 2 diabetes for over a decade. She was diligent with her medications, careful with her meals, and tried her best to walk every day. What she didn't know was that diabetes, slowly and quietly, was affecting her blood vessels. One morning, as she was chatting with her grandson on the phone, her words began to slur. Her right arm felt heavy. Within minutes, her daughter recognized the signs and called 911. Helen was having a stroke. Helen's story is far from unique. In fact, adults over the age of 60 with diabetes are up to twice as likely to have a stroke compared to those without diabetes. But why does this connection exist? And more importantly, what can you do about it? To understand the link, let's first look at what diabetes does to the body over time. In simple terms, diabetes means that your blood contains too much glucose, or sugar. While glucose itself isn't harmful, in fact, it's the fuel for our cells, too much of it acts like a slow-moving corrosive, damaging the delicate lining of blood vessels throughout the body. Imagine your blood vessels as a vast network of highways, carrying oxygen and nutrients to every corner of your body. Over years of high blood sugar, these highways begin to crack and erode. The walls become sticky, attracting cholesterol, fats, and inflammatory cells. Little by little, the vessels become narrower and stiffer, a process doctors call atherosclerosis. Now picture the brain. It is a remarkably hungry organ, needing a constant, rich supply of blood. When the blood vessels supplying the brain become narrowed or blocked, the result can be devastating. A stroke. There are two main types of stroke. Ischemic, where a clot blocks blood flow, and hemorrhagic, where a blood vessel bursts. Diabetes dramatically raises the risk of both, but especially ischemic stroke. But the story doesn't end there. Diabetes doesn't travel alone. It often brings along high blood pressure and high cholesterol, two more culprits in the stroke story. High blood pressure puts extra strain on those already weakened vessels, making them more likely to burst or clog. High cholesterol adds even more sticky plaque to the vessel walls, narrowing them further. There's another twist to this tale. Diabetes can also damage the tiny blood vessels deep inside the brain, leading to what's called silent strokes. These may not cause obvious symptoms at first, but over time, they can add up, causing memory problems, difficulty walking, and even dementia. If the risks sound frightening, that's because they are. But knowledge is power. The real story here is not just about danger, but about hope. About how understanding the hidden connection between diabetes and stroke can empower you to take charge of your health. Let's explore what you can do, starting today, to break this dangerous link. The first step is to know your numbers. If you have diabetes, you're probably already familiar with your A1C, a blood test that shows your average blood sugar over the past 3 months. But don't stop there. Be sure to have your blood pressure and cholesterol checked regularly. Work with your doctor to set goals that are right for you based on your age and overall health. Next, let's talk about lifestyle. The small daily choices that add up to big changes over time. You don't have to run marathons or give up every food you love. In fact, the most effective changes are often the simplest and most sustainable. Start with movement. Walking is one of the best exercises for seniors. Just 30 minutes a day, most days of the week, can help lower blood sugar, blood pressure, and cholesterol all at once. If walking is difficult, try chair exercises, swimming, or gentle yoga. The key is consistency, not intensity. Nutrition is another cornerstone. Focus on foods that nourish your body rather than spike your blood sugar. Fill your plate with plenty of colorful vegetables, whole grains, lean proteins like fish or chicken, and healthy fats such as olive oil and nuts. Limit processed foods, sugary snacks, and salty meals. Remember, you don't have to be perfect. A little progress each day matters. Medications are often necessary, and that's okay. If your doctor prescribes medicine for diabetes, high blood pressure, or cholesterol, take it exactly as directed. Never skip doses, even if you feel fine. These medicines are working behind the scenes, quietly protecting your blood vessels and reducing your risk of stroke. Don't forget about regular checkups. Make sure to see your healthcare provider at least once or twice a year for a thorough evaluation. Your doctor can help monitor your risk factors, adjust medications, and spot any early signs of trouble. But there's one more piece to this puzzle: knowing the warning signs of stroke. Because when it comes to stroke, every second counts. Remember the acronym FAST. Face drooping, arm weakness, speech difficulty. Time to call 911. If you or someone you love has sudden trouble speaking, numbness on one side, or loss of balance, don't wait. Call for help immediately. Rapid treatment can mean the difference between full recovery and lasting disability. Let's return to Helen's story. Thanks to her daughter's quick action and the hospital team's expertise, Helen survived her stroke with only mild weakness in her hand. She was determined to regain her independence, so she worked with her doctors, learned about the diabetes-stroke connection, and made some changes. With physical therapy, medication, and support from her family, Helen was soon back to gardening, walking her dog, and enjoying her grandchildren. She became an inspiration in her senior community, reminding others that knowledge and action go hand in hand. Helen's journey is a testament to the power of awareness and the strength of the human spirit. But it's also a reminder that we all have a role to play in our own health story. Whether you have diabetes or care for someone who does, understanding the hidden connection to stroke is the first step in protecting your brain, your independence, and your golden years. Let's take a closer look at a few more ways you can lower your risk. Stay hydrated. Dehydration can make your blood thicker and more prone to clotting. Aim to drink plenty of water each day, unless your doctor has given you other instructions. Don't smoke. Smoking damages blood vessels and accelerates the buildup of plaque. If you smoke, talk to your doctor about quitting. There are more tools and supports available than ever before. Limit alcohol. Too much alcohol can raise blood pressure and interact with diabetes medications. If you choose to drink, do so in moderation. Manage stress. Chronic stress can raise blood sugar and blood pressure. Try relaxation techniques like deep breathing, meditation, or simply spending time in nature. Get enough sleep. Poor sleep can make it harder to control blood sugar and increases stroke risk. Aim for 7 to 8 hours of restful sleep each night. Keep up with your eye and foot exams. Diabetes can cause nerve and blood vessel damage throughout the body, not just in the brain. Regular checkups can catch problems early and prevent complications. Stay connected. Isolation and loneliness can make it harder to manage chronic conditions. Reach out to friends, family, or local senior groups. Sharing your journey makes it easier to stay motivated and informed. For many seniors, the most powerful step is simply to ask questions. If you're not sure about your personal risk for stroke, bring it up at your next doctor's appointment. Ask about your blood pressure, cholesterol, and A1C goals. Find out if there are other screenings or preventive steps you should take. Remember, you are the expert on your own body, and your healthcare team is there to help. At Life Advice for Golden Years, we believe that the best health is built on knowledge, action, and hope. The connection between diabetes and stroke may be hidden, but it is not inevitable. With the right information and support, you can protect your heart, your brain, and your future. Let today be the day you take charge. Review your medications. Schedule that checkup. Go for a walk with a friend. Learn the warning signs of stroke and share them with your loved ones. Every small step is a victory on the path to a longer, healthier life. Because your golden years should be filled with laughter, purpose, and joy, not clouded by fear or uncertainty. By understanding the hidden connection between diabetes and stroke, you give yourself the gift of knowledge, the first and most important step toward a brighter, healthier tomorrow. So here's to you and to all the chapters yet to come. Stay informed, stay active, and never stop believing in your power to shape your own story, one healthy choice at a time.